So our webinar today is talking about EU-PROMENS. We will introduce you a little bit this big project, this big program, and one part of EU-PROMENS is the headline for today. On Tuesday, we introduced you, I don't know if you were there or not, but you can watch it on the internet, the webinar. Today we will introduce you the exchange, or we have the focus on the second big part of the program of EU-PROMENS. It's the huge exchange program, and we will introduce you the program, what we have done so far, and what will be the next steps, and we will have enough space after the presentations, enough time after the presentations for questions and answers, and I hope we will have ongoing motivated discussion at the end. You can see here the program. So we have 90 minutes, and we will take care to stay in this frame, and you can see here we will start with a presentation from Chiara Giusto, representing the HDEA, the European Health and Digital Executive Agency. Then we will introduce you more about EU-PROMENS, and then we will show you what we've done so far, and we will have also testimonials with us, talking a little bit about their experience in the program, and then we will come to the question and answers session. Okay, so the first presentation we will see is the presentation from Chiara Giusto, informing us a little bit about the frame, the background, and the political frame and the technical frame of the program in total, and the idea from the European Commission, DG Santé and HDEA behind. Please, Chiara, it's yours.
Good morning, Tom, and good morning, everyone. Thank you for inviting me to this important webinar. We are talking about mental health, and even though sometimes we look at mental health as something related to invisible scars, it is still very, very much important to talk about this topic, even more so during the European Mental Health Week, and under the theme of this year, Care for Mental Health, Invest in Social Rights. And this is something very pertinent, because EU-PROMENS is a project that invests in capacity building, in equipping professionals across Europe with better skills to address mental health needs. So I think it is a contribution to a societal change. When we engage with different stakeholders on the ground, frontline workers, communities, institutions, to make a better service in healthcare for mental health. So as it was said, my name is Chiara Giusto. I work in the European Health and Digital Executive Agency. I work in a unit which deals with the EU for Health program, and I manage procurement as a funding instrument to implement the program. So today I wanted to give you a bit of the context that helps you understanding where does EU-PROMENS come from at the end. So in the European institutions, we work closely with the European Commission. As you can see on the left side of the slide, the Commission services, they project a bit policy priorities. They define priorities in the present and in the future for Europe. And these policy priorities are translated into work programs, so actual implementations to make these policy priorities reality. And so on the right side, there are the agencies, and HDEA is one of these agencies, and we have the mandate to implement the work programs drafted by the Commission through different funding instruments. We have grants through call for proposals and procurement procedures through call for tenders. This is how we manage the funded projects. Our agency, so ADEA, is not just about health. So in the title, you listen health and digital, but we have different sectors covered under this agency: health, food, space, industry, and digital. So you see, we have different programs. And this means then that our agency interfaces with different commission services. We call them the parent DGs. So as you can see in the light blue bubbles, in our agency, ADEA, which is in the middle, we mainly have to discuss and to interact with ERA and Santé for the EU for Health program. Of course, the other commission services, they deal with other programs under the same agency, but for EU for Health, of course, we deal with ERA, the European Health Emergency Preparedness and Response Authority, and DG Santé for health and food safety. So you see that there is a coordination between ADEA and different commission services. If we go to the vision of ADEA, so we want to boost Europe from Earth to space, because you saw that we have different type of policies from the Earth up to the space, healthy society, digital economy, and competitive industry, because we also have a program to boost competitiveness for small and medium enterprises. So what we do in practice. So what are these programs that we manage? As you can see, there are 5 different sectors, and within these sectors, there are different programs. For health, I've already said I work for EU for Health program, and then there is the Horizon Europe Cluster 1, which is about health. For food, we have the Single Market Program, SMP, the digital. We have Horizon Europe again under the cluster of digital, Connecting Europe Facility, and Digital Europe program. Industry, Horizon Europe, the industry, the cluster on industry, and the same for space, Horizon Europe cluster on space. Of course, you know, maybe Horizon Europe deals more with research under different clusters. And for health, we have also EU for Health as another program under the same sector. Who is benefiting from all these programs, all these funding instruments also that we use to manage EU funding? So the beneficiaries can be industries, SMEs, research institutions, academia, international organizations, national, regional, local authorities, civil society organizations, associations, and NGOs. And then in the next slide, we see which type of projects we fund. So through our projects, we fund research and innovation, knowledge sharing, trainings, as you will hear, and you've heard also about EU-PROMENS, networking events, capacity building, again, software design, and manufacturing. Manufacturing, for instance, of medical countermeasures, vaccines, therapeutics, or diagnostic devices as well. So let's go a bit more, let's go and narrow down a bit on EU for Health. So EU for Health is the program under the health sector in ADEA, and we do procurement actions. Our vision is to have foster health in Europe, to have better health for all European citizens. I wanted to say that unfortunately, due to the COVID-19 pandemic, which was not a good factor, but that was the one that triggered the creation of the EU for Health program. So there you have the EU for Health program is a link, and so you see the vision for a healthier union, and you can access it, which is a bit the summary and the explanation of why we have the EU for Health program since 2021. Then going down to different things that we can buy, we can purchase through procurement, we have also trainings. And here I put just a number of trainings that you can see and were purchased through procurement procedures. Preparedness, so to help national authorities to have good emergency and preparedness plans. you see in the middle EU-PROMENS. We have trainings for professionals, also exchange visits through EU for Health program. Then you have digital. So we have trainings on how to boost digital health services. In the future, we hope to have a fully interoperability system across different medical recordings in European countries. And the training on blood tissue and cells, so the substances of human origins. So also member states, national authorities are trained on this topic as well. So this is just an example of different trainings that we fund through EU for Health. Going even more in depth on the policy, because what I said is that the Commission defines the policy and the trajectory for the future. This is the comprehensive approach to mental health, a recent policy document that was published by DG Santé and which presents a new vision on mental health, which is not a vision in silos, but an interdisciplinary approach, a comprehensive approach to mental health. And this was, and the reason why we came up with this new policy on mental health was that if we look at the needs and the mental health needs in figures, we see that the situation is worrisome. I'm sure that the people that are attending this webinar are well aware of the situation, but 1 in 6 people suffered from mental health issues before COVID-19 pandemic, and the pandemic did not help diminishing these issues, but rather increasing. Suicide is also another factor that is growing even among people aged between 15 and 19 years old. And then there is a cost also, which we can mention, attached to unmet mental health needs, which is about 15 billion euro per year. There you can see, I just mentioned the state of health in the EU 2023, where mental health was flagged as one priority to take action on. So we need to reform, we need to rethink mental health and how we address mental health needs in our countries. And so this is why the comprehensive approach was presented and was published as a new policy document from the Commission. And then if we continue, there are, of course, in this comprehensive approach, there are guiding principles. And you can see there are 3 guiding principles. We look at prevention, we look at treatment, and we look at reintegration and recovery. So there is this full cycle of mental health needs to be addressed in different stages of the health sector and also in this multidisciplinary approach. There are 20 flagship initiatives, and the deliverables, the toolkit that is included in the EU-PROMENS project is one of the flagship initiatives. So this project will produce some important deliverables, milestones that are counted as one of the flagship initiatives in the policy document. And there are 1.23 billion in funding opportunities spread across different funding instruments to make sure that this comprehensive approach to mental health is improved or becomes more a reality. If we move ahead, when we say all these initiatives, funding instruments, programs, stakeholders included, we need to have a kind of coordination. And the coordination is also possible through synergies. So it is ADEA's also mandate to run and to conduct a synergy exercise to make sure that, for instance, there are complementarities, there are good practices, funding are used in the best way possible within procurement, in grants under EU for Health program, but also, for instance, in Horizon Europe Cluster 1. So we are trying to find similar projects involving trainings for mental health and see how we can complement each other, learn from each other, and then track these synergies that we have identified. It is really a learning by doing exercise, in the sense that the more we share, the more we can find synergies and avoid duplications and work in a more efficient way. So, for instance, talking about synergies, we have EU best practice portal. So that you have the link in this portal, you can find 25 initiatives, identify either as best or promising ones. So you can have a look at these initiatives, take what is important for you or for your organization, and also translate into your reality in your setting, for instance. In terms of implementation, to implement these activities and these initiatives, we have member states, because there is a public health expert group with member states representatives, and they discuss the EU for Health program, and member states can also benefit from funding opportunity under grants, for instance, through joint actions. Stakeholders, as I said, there are many stakeholders, and there is an online network on the EU health policy platform. So the stakeholders are aware of what's going on under the health policy. And then, of course, you need to look for instance, mental health as one of the subgroups under the health policy. And there is a tracking framework. A tracking framework is managed by DG Sante, because they are monitoring the implementation of the flagship initiatives, including EU-PROMENS as one of them. And then I wanted to conclude, this is my penultimate slide, with the EU health policy platform. This is a platform that I mentioned also in the slide before because of the stakeholders. So in this platform, you can register as an organization, as an individual. There is a process, but then there it's like an arena where you can see updates, public events, you can see products in terms of deliverables, projects, studies, reports. It's a wide public health community where you can exchange. So you have the link. It's worthwhile having a look and see how to be kept abreast of what's happening now and in the future on health policy platform topics. And then the last slide is just a collection of links. If you want to know more about ADEA, about EU for Health program within ADEA, or Horizon Europe Cluster 1, or the other programs, and then for the European Commission as well, you can follow the policies and the services on these links in social media. I remain at disposal for replying to your questions, and I hope it was a bit informative for you and you managed to know a bit more of what's behind the scenes of EU-PROMENS, for instance. So thank you so much for your attention.
Thank you very much, Chiara. When you have questions, please wait a little bit, and after our presentations, there will be enough time to write the questions in the chat or to discuss them via via Zoom directly with us. So I was always looking with one eye in the chat because I invited people to introduce themselves in the chat, and I'm really happy. We are almost 60 people now, and from so many different countries. This is really, really nice, and important for us to spread our information all over Europe. And we have, I noted down, also guests from the Canary Islands, and also very, very welcome the guests from Iceland and from the very north of Europe, and also outside European Union guests from Great Britain and from Serbia. So very, very welcome. Thank you so much for joining us. Okay, so I will continue on the next slides to tell you a bit more about the EU-PROMENS. Chiara already mentioned different points. So maybe, Martina, we can start. So you can see here, Chiara talked about EU-PROMENS is a program, a project in the program of EU for Health, and it's financed from EU for Health. And we are really happy about this, and thank you very much to the European Commission doing such intelligent and useful programs and initiatives to enable this. Our project is managed or done by 3 different organizations. There is a consortium. The leading organization is GFA from Hamburg, a big consulting organization with a long tradition in this part. And there are 2 supporting organizations. On one side is Trimbos Institute from the Netherlands. They are very focused on mental health services and specialized services for addiction people or people with addiction problems. And the third partner is very well known and is organizing the frame of our webinar today. This is Mental Health Europe. And they are representing a lot of organizations, NGOs, user organizations all over Europe in the field of mental health. And they are also partner in our project. Okay, next slide, Martina. Here you can see EU-PROMENS goal. We are working in in 30 different countries. The 27 member countries are part of the program, and additional to this, we also implement our program in Ukraine, in Norway, and in Iceland. So we are 30, and for the implementation of the program, we identified 6 hub countries or 6 hub partners in Europe, and this is important especially for the exchange program because the training is implemented in all 30 countries, but the exchange is possible in 6 different countries. This means you are all invited from all the 30 countries, but you can visit and you have to decide which one of the 6 hub countries you want to visit. We have Finland, we have the Netherlands, we have Czech Republic, we have Austria, we have Croatia, and we have Spain decided for, and we split it. In total, we have 900 places for the exchange visits, and we already almost finished the first wave. With 450, only one group is missing in Spain, and then we have done the first part of the exchange program, and we will finish it in September, and in October 2025, the second wave will start, and you will be informed later about the timeline and how to apply and what you can do to be a guest in one of our hubs. The general objectives of EU-PROMENS, Chiara already talked a little bit about the toolkit and the training. So we have 3 main pillars: toolkit, training, and exchange. The content-related targets were already presented from Chiara. It's this comprehensive approach, this multidisciplinary approach, and we try to support professionals working in the field of mental health with introducing new concepts, introducing innovative methods, connecting them with other peoples all over Europe, and finally, we try to prevent burnout. We try to prevent dropouts for professionals in this field. So, as I said, we have 3 main pillars from the output. The first one was presented on Tuesday. This is the multidisciplinary training program on mental health. In this frame, we developed based on a really huge research we've done at the beginning of the project, and we asked experts in all 30 countries to come with their ideas and to help us to identify the gaps in the qualification, education sector in the mental health field. And based on this research and these results, we developed a training program, and we started last week to implement this training program in our hub countries, and after the hub countries, we will roll out the training in all the remaining 24 other countries participating in our project. In total, we have there 3,500 places in the seminars, and you are invited and very, very welcome to apply for one of these places in our seminars. The second big part, and what we are talking today, is the exchange program. So we invite professionals from different sectors, professionals from working in the mental health care sector, social workers, social pedagogues, people working in the prison sector, but also service user representatives, policymakers, stakeholders. So we invite all these people to visit other countries, and it's not a short visit, it's really a big program. The one exchange is lasting for 2 weeks, so you are invited in one of our hub countries to visit different services with different headlines. We try to cover all the different fields in the mental health sector, so each of our hub countries has a different headline, a different focus, from anti-stigma campaigning to being focused on forensic services, focus on community-based services, focus on research. You can find all this information also on the webpage, and you can decide for which countries you are applying for participation of this exchange. You will be informed also later on that all costs for these trips are covered, so travel costs, accommodation costs, transport costs, all these things are financed via the project, and so only the staff costs you have to cover by yourself. So identifying exchange participants' needs, host institutions' capabilities, and matching both was at the beginning of the project. And also for this exchange program, we did a big research, and based on this research, we organized with our hub partners a very individualized program, and from hub to hub, different program, and hopefully addressing all the different sectors in the mental health field. And the third point, the third pillar is, Chiara talked about the toolkit, and we already started to work on it, and it will be a guide, hopefully a very, very helpful document for policymakers, for stakeholders, for people working in the sector, but we will write it in a way that also newcomers in this field can use it, and will have hopefully a lot of useful information and basic points which are needed when you want to decide or when you want to work in this field. Yeah. Please. Okay, so I give the floor to Ildiko now. Ildiko Meni. She is the coordinator in the frame of our project of the exchange program, and she will talk a little bit more about the exchange program. Thank you.
Yes, good morning, everyone. My name is Ildiko Meni. I'm the exchange exchange coordinator of this wonderful program. My background is psychiatry and public health. And I now show you what we've done so far. So Tom already mentioned a lot. We decided in the very beginning on our 6 hubs. So the chance to visit either Zagreb or Helsinki, Prague, Linz, Hertogenbosch, sorry for my pronunciation, and Barcelona. And there we also started the process of really partner with either the university hospital. There is the Valo Valmenus. We will later have someone from Valo Valmenus Desideritis also presenting about the exchange. And in Czech Republic, we partner with the National Institute of Mental Health. In Austria, we partner with the PROMENS, which is the oldest organization also in Austria, one of the oldest. And in Netherlands, this definitely is the oldest foundation, Reinier van Akel. It's connected to the oldest psychiatry in the Europe. And in Barcelona, we partner with the Parc Sanitari San Juan de Déu. And Tom also mentioned our goals. So when you take part in the 2-week program, we took really a life cycle approach that together with our partners, we put up the programs to make it most interesting for everyone. So we want to promote and strengthen your organization, and you with capacity and knowledge. We want to facilitate the exchange and transfer of knowledge and the best practices. Chiara also mentioned between countries and to countries in Europe and beyond. And of course, always connected to the national mental health systems. And overall, at the end, we want an overall harmonized, standardized, competent and resilient European workforce. Next slide, please. Yes, so we here also today we have the whole team, our whole team, and this is also an interesting part, also represents different professional profiles. And now I give the floor to my colleague Irena. Our colleague Galin put together a potpourri of impressions on all what happened already. So these are the pictures from Austria, and Irena will take the floor to give you some impressions.
Thank you, Ildiko. So hello, everyone. My name is Irena Stankovic, and I'm engaged as a mental health expert for EU-PROMENS. I'm very happy to share with you today a few reflections from the EU-PROMENS Exchange Programme hosted by our Austrian hub, which took place in March this year across 3 locations in Austria, in Wessenufer, Linz, and Vienna. So the program was hosted by Promente Upper Austria, a long-standing organization that is committed to building accessible, community-based mental health support. Across 2 weeks, participants from different countries and professional fields came together to explore how care can be organized in ways that are practical, respectful, and rooted in everyday life. What stood out clearly was the diversity of learning moments. Participants visited services focused on addiction prevention, vocational reintegration, creative and social recovery, and support in everyday living, including models of inclusive employment like the Wessenufer Hotel, which not only hosted our groups of participants during the first 2 days, but also demonstrated how a supportive work environment can promote well-being and inclusion in a very tangible way. Throughout the visits, participants engaged with professionals and teams who work in close connection with our communities. and are offering support that is built around people's needs, daily realities, and strengths. There was a focus on early intervention and prevention with attention given to how schools, families, local systems can work together to reduce harm and strengthen mental well-being over time. What participants repeatedly highlighted was how person-centered and relational these services felt. The approach wasn't focused on labeling or categorizing people, but on meeting them where they are with care that supports recovery, autonomy, and social inclusion. And beyond the formal learning, something else was very clear. This exchange mattered on a personal level. The group was made up of professionals from health, education, social care, and justice, including participants with lived experience. While the backgrounds of our participants were very different, what grew between them was a sense of shared purpose and mutual respect. Many built professional and personal connections. It was noticeable how much people valued simply having time and space to learn from one another, to reflect, to feel supported by a wider network of peers who understand the complexity of the work. And in the end, the impression is that the Austrian exchange program offered not only meaningful learning, but a kind of motivation and human connection that stays long after the visit ends. Thank you.
Croatia, we have our dear Mika.
Yeah.
You can see him now in live.
Yes. Thank you, Ildiko. Hello, everyone. My name is Miroljub Nikolic. I'm from Serbia, and I'm engaged in EU-PROMENS Project like social protection expert. And I'm very happy that I was involved in exchange program and also in training in Croatia. We are neighbors, and everything started with Croatia because exchange visit in Croatia was first exchange, and I think that we have a lot of lessons learned from this visit. I need to say that we have very good partner, our hub, University Hospital of Zagreb, Clinic for Psychiatry, and even it is a hospital. We promote very good community-based approach, and it is obvious that multidisciplinary in all level is important to provide good quality of life and services for people with mental health problems. The main issues which we had in Croatia, it was addiction, about drug, gambling, and other things. Also, early intervention methods for first episode psychosis, innovative treatment and reintegration programs, psychosocial interventions, mobile outreach and home treatment teams. So it was many services which we visited with various social and health providers from state sector, NGOs, private. So it was possibility to see. It is my field, let's say, rehabilitation center Stančić in Croatia. It was excellent example of transformation. They was the biggest institute, social institute for people with mental health problems, and now they are community-based related. So, for example, they now have 200 beneficiaries inside center and 500 outside using home care services, assisting living, and others. So, evaluation shows that our participants were very satisfied, and I hope that we will be able in a second wave to have the same things. So as a colleague said, you are invited to apply for second wave, and you're welcome. Thank you very much for attention.
Thank you, Mika. And the next hub is Czechia with our dear colleague Dora. Dora, are you here? Dora, so I can even tell a little bit if Dora is not coming. Even currently, we have a group. Yes.
Sorry. Hello. I'm
Okay.
sorry. I was just, hello to you all. I was just having trouble in unmuting my microphone. So first of all, thank you again for being here with us. So I'm Dora. My name was said many times because I was muted and my colleagues were starting to worry. I'm based in Portugal, and I work for EU-PROMENS as both a mental health expert and an education expert. And I am going to give you some insights about Czech Republic exchange. So our partner has already said it's the National Institute for Mental Health, and I would like to give to you two perspectives, the technical perspective, and then, as already also mentioned, but very important, the personal perspective and the human bonding perspective. So from a technical point of view, the exchange program is really good and very well balanced. It has an overall continuum. It starts with an introduction on the national system and the national structures, which provides context for everything that is going to be seen afterwards. And it addresses specific topics that are not addressed in other countries, because also, as mentioned, we aimed for what we thought were the main strengths of our hubs and what makes them really different and special. So it addresses research in psychedelic. It addresses a national anti-stigma campaign, which is something that we only have in Czechia. It addresses the topics like the Center for Sexual Health. And in the Center for Sexual Health, they work also mental health topics like LGBTQ+ and other topics that are related with mental health. And so participants have lectures and acquire theoretical knowledge and, of course, some practical knowledge on interventions, and then they can go and see the interventions that are mentioned previously. So they can visit the National Institute of Mental Health, and they visited Focus Praha, which is also an NGO and provides several community-based services. And they visit the psychiatric clinic, the biggest one. So they make a lot of visits to integrate with the theoretical part. There is that expression that the best practice is a good theory, but also good theories come from practice. And then there's the human point of view in the personal growth aspect, which is also really important. So, and for this point, I would like to divide this into different topics. First is actually the bonding between the participants and the sharing of knowledge and experiences. So we provided space for them to bond from the early beginning of the exchange and provide this space, this safe space for them to share their experiences as professionals, for them to share knowledge, for them to ask questions, for them to feel welcomed and connect in this sense of, as my colleague Arina already said, in this sense that they still remain connected. And we have WhatsApp groups that can show us that participants, after being in the programs, they still stay connected and they share their experiences afterwards, the program, which is quite amazing. And then there is also this personal growth and uncovering hidden bias about the mental health topic. Because as we provide this safe space, our participants also feel safe to share their own experiences with mental health. Some of them already have been depressed, some of them already have anxiety, some of them have burnouts, for instance, because the profession is very demanding. And this is also very important in the sense that sometimes we work in the area, but we are a bit afraid of also sharing our experiences, which is a bit ironic, because if we aim for mental health for all and we see it as a priority, we, and when I say we as professionals, should also be open to share our own anxieties and difficulties in the area of mental health. And so our participants also did this and found in the group a safe space to share this and support each other in this sense. So the exchange provides amazing insights on particular aspects of mental health, and like I said, both in the area of research, both in the area of community-based interventions, both in the area of psychiatric clinics. So we go the full circle of prevention, treatment, and recovery and reintegration. And also provides participants this space for them to grow as human beings and also feel safe in a group to share their own experiences, both in terms of knowledge and both in terms as their personal feelings. So we believe that we are making a good job providing professionals to have all of these opportunities to grow and to acquire knowledge and to take something to their countries and with themselves to start changing interventions and also start changing their own capacity on dealing with their own mental health and with the persons that they attend to every day. So I guess this is a bit of insight on Czechia. And of course, if any questions come up at the end, we will be here to answer. And thank you. Thank you so much.
Thank you, Dora. We have 3 more countries to cover our hubs. The next is Finland. My dear colleague Katarina will say a few words.
Thank you so much. So good morning, everyone. I'm Katerina Yeliseva. I'm originally from Estonia and based in Italy. In this project, I'm the mental health expert. So our partner in Finland, Valo Valmennus, is a non-profit national association improving access to learning, employment, well-being and participation in the society. And the exchange visit that they organized in March this year had the focus on lifelong support, promotion and prevention of mental health at different stages of life, including the provision of mental health services for people in vulnerable positions. And as for the highlights, the first thing that strikes me when I look at those pictures is the spirit of unity and joy of being all together. And you see here in these pictures a conclusive workshop. So the last day of intense 2 weeks organized by our Finnish colleagues, which took place in 2 cities in Finland, Helsinki and Tampere. And so for me, it was so interesting and inspiring to observe how participants of the program were building the picture of Finnish mental health promotion and prevention services system puzzle by puzzle every day. And I heard many inspiring conversations during the week. And what stayed with me most is that colleagues of diverse professions made long-lasting connections, not just across Europe, but also in their own countries, which really is the goal of the project that aims at improving multidisciplinarity of mental health approach. And participants also had a lot of ideas on how to apply the knowledge that they acquired in their home countries, but also how they felt like they belonged to a new community, which gave them strength to go back to their country and work towards this holistic psychosocial approach, despite many challenges and feelings of isolation that they expressed during this exchange visit. And I think this is what my colleague Dora was also highlighting, that the project really, this exchange visit really creates a safe space and a feeling of community. So this is in a nutshell what comes to mind after my visit to Finland, and thank you again so much to our Finnish colleagues who worked so hard on the program, and the program was so diverse, participative and active. Thank you.
Thank you, Katarina. Thank you so much. I think we have to speed up a little bit because we want to have some questions also. So for the Netherlands, I also only mention again that this was our partner is, you can see the church in the background, is the oldest psychiatry in Europe, which now is still running. And of course, it is one of the most innovative and recovery-oriented and community care-oriented institutions of the Netherlands. So that is all what I say. You can see we also give out diplomas at the end, certificates, and there was on the bottom right also the connection to the municipality. We are always have either someone from the municipality or the group has the chance to meet in the municipality. Thank you. So the next will be Spain with our dear colleague Vitaly.
Hi, I'm Vitaly Kanchuk. I will speak a bit about the Spain, but I will also try to be short. I understand the time. In Spain, we are meet in Barcelona, and it tells a lot about the program. The program is really packed. The program in Barcelona is really full with, first of all, it's focused there are a lot of focuses actually, but definitely it's a community-based approach. We partnered with San Juan de Dios Foundation, which is very large service provider. It's not a clinic; it's a foundation which contains a lot of services all over the Catalonia, and but the most prominent thing is all of the services are really community based. For example, you have a possibility to work with psychiatrists who walk on the street and speak, looking for homeless people, and speak to homeless people and discuss their problem and proposing treatment and not just treatment but other social protection options, etc. You will visit a prison when you will need mental special services for prison for people who are imprisoned, and also for people in acute state who went through some shit in their life and now in rehabilitation process. A program is also there is a lot of this program about prenatal mental health, and for example, special program for mother and baby stay, where mothers has acute symptoms of some mental health conditions, so they try not to separate and get them together during all of this process. So program is absolutely terrific, and also there is only one thing. If you're planning to visit this program just to visit Barcelona, just forget about it. So you will don't have a time. You will have time to visit it and to see places in Barcelona. You will see only services, people, professionals. It will be not just 6 or 8 hours work day. It will be 24 hours work day for you. The program is exhausting, as all our program. So just be ready, keep yourself and prepare, train yourself before attending exchange program. To keep yourself fit and prepare yourself for different things which you might face For example, in our last exchange, one of the participants tried to ride a bike. Do not ride a bike for example, in a city which you don't know well. So, welcome to Spain. Welcome to Barcelona.
Thank you, Vitaly. Yes, so this was the warning also about the foreign cities. So our target groups, now I will really speed up a little bit because Tom already mentioned that we invite really mental health professionals, educators, teachers, social workers, and of course, especially professionals working in the prison and juvenile detention centers, policymakers, to our exchange program, to the next wave. All what was shown was done from last October, and the last group is going to Spain this September. There's one group currently in Czech, and I will not read now the testimonials because we have invited also one participant. You can see what happened and what we received over 1,700 registrations and what was delivered. Next slide, please. So also this is maybe a quite complicated slide. It will only show that we really currently between the waves do a lot of monitoring and evaluation. We really want to make this exchange as equal as possible. So at the bottom left, you see that we are monitoring the professional profiles. Again, we have a participants in the light green coming from the mental health professionals, and then the blue is it's the social workers, and the blue is the teachers. We still miss some participants from the prison sector. So if you are from the prison sector, please come to our exchanges. And also we want to make it the most equal. So we really encourage people from Germany and France also to apply. We, of course, monitor the knowledge gain. We really want you, as Vitaly said, to learn a lot. So, and we monitored that the participants had a 5.5 improved quality of work. They should also share what they learned in their workplaces. And we really are glad that almost over 90% did. And yes, so also our participants do some small talks at the conclusive workshops. You have to present what you learned during the 2 weeks. Thank you. And then I think this is my last slide. What's coming next, I will hand to our wonderful event manager, who is really, without them, we could not run the whole program. Martina Ranzi, please.
Thank you, Ilti, and good morning, everybody. So my name is Martina, and I am one of the event managers of this program. And I'm sure you will be now wondering how to be part of all of this. Still hoping that Vitaly did not frighten you too much. So as it was anticipated, we have almost successfully concluded the first wave of the exchange program and are now ready to kick off the second wave. In between, we stopped for a moment of reflection and analysis. We have taken into close consideration all the feedback we have received from participants, from our local experts, from the partners on site, and also from the EU-PROMENS experts which have been there before and during the exchange. So this reflection mainly ended up in a slightly shortage of the visit, as it is so long and exhausting. Following participants' recommendation, we have shortened the working days from 10 to 8. So you will travel on Monday and be right back home on the Friday of the following week. As you can see in the slides, dates have already been set for mostly all our hosting countries. Croatia, Czechia, Austria, and Spain will replicate the approach they had in the first wave, hosting the 75 participants in 3 different groups of about 25 people, while on the other side, Finland will also replicate the successful approach of hosting all the 75 together, and our Ida will tell us more about this. And just the Netherlands decided to switch from A to B, and so will host as well all the 75 in a big group at the end of November. So how can you be part of all of this? You can visit us on our website. You can see the URL in the slide, or you can scan the QR code, or simply you can go on your browser and type in EU-PROMENS and you will easily find us. On the website, as you can see in the screenshot, you will find a page dedicated to the exchange program with some general information, more or less what we have been telling you today. And then scrolling down, you will arrive to our countries pages. So at the moment, registration are already open for Croatia, Czech Republic, and Austria. Registration deadline is on the 12th of July, but we recommend you not to wait the last minute, because in the first wave we have received really many applications, and of course we have some requirements to respect. We try to make the best mix of professional profiles and of countries, but as always, who first counts is better served. Clicking on the country pages, you will find all the information both on logistic and on the program, so you will have the chance to go deeper in what our experts have shared with us. As Dora said, we tried to give a special focus on the peculiarities of each of our countries, and still there you will have the chance to register. So you simply need to fill in a registration form. It takes between 10 and 15 minutes. We are just asking for your professional background, job title, and a few lines for motivation. As I said, we received many applications, and we really would like to give this chance to really motivated professionals. So once you've done that, you will receive an confirmation email and then another email when the registration closes, and you will be informed if you have been pre-selected or if you are in the waiting room. In the first case, you will need to fill in a second registration form to allow us to organize your trip. So as Tom mentioned, we take care of your travel. We book your flight, your accommodation, the internal transport, and all costs are covered by the project. If you are in the waiting list, don't be worried, because it happened quite often that people cancel participation, and so you may still receive the seat. I would also like to mention, to complete the information, you have the possibility to register for more than one hub, but you will be selected only for one of them. So if you have some preferences, please let us know, but feel free to register for more than that. Last but not least, I recommend you to sign in for our newsletter. You can either scan the QR code here in the slide, or you can register through our website. You will not receive so many emails, don't be worried, but just be informed on the opening of the registration calls. So for example, Netherlands registration will be open 1st June, and you will receive an email informing you about that, and also you will be informed about the opening calls of the training program. And I think that's all from my side. If you have questions, please feel free to write them in the chat or to keep them for our Q&A session. And I will now leave the floor to our participant Zoe, which joined us in the Austrian visit. Thank you.
I'm Zoe, and I was in the Austrian program. So I'm a PhD student in Ireland, and I was really interested to kind of join another program and just learn from how another country is doing mental health support and care. So the program was really lovely. We had a whole mix of professionals, from people who had like 30 years experience to people who hadn't even graduated from their undergraduate yet, you know, all across different professions: psychiatry, psychology, social work, creative health practitioners, a whole range of people, and people with lived experience as well. And I think it was a really lovely experience, like going on this journey with all of these different people with all different experiences, and just learning something new in a different country, and you know, going on the kind of journey in Austria. So Austria, you know, the services over there are very community focused, and certainly when we're thinking about like you know, the European Mental Health Week theme of social rights, that's something that Austria definitely does really well. The range of like vocational services and like it's very a work-based program in Austria, where people are given the opportunity to kind of develop skills and go on a kind of workplace program. Visited like woodwork factories, bookbinding places, sewing factories, garden centres, the whole range of different kind of places where people can kind of work and build up their skills. And even just connecting in with the other professionals and like, you know, kind of reflecting on what we're learning every day was just lovely. One thing as well that kind of brought me to Austria was kind of their emphasis on like the arts and like recreational kind of supports. So there was just a really lovely art centre which had like, you know, open painting studio, like drama sessions, music, and I think that's what really kind of drew me to going to Austria and having a look at their kind of arts-based supports. And you know, I think something that I really took from Austria is that, you know, when they do their services, they do it really well. Like the arts centre wasn't just like a hall of like random art supplies. It was proper, like the drama studio was a proper drama studio with the proper lights and everything. You know, actors were working there and working with the people who were coming to the centre. So it just really kind of gave us a really nice sense of like the breadth of supports that can be achieved, and you know, just kind of reflecting then on kind of how your country is doing things, and kind of I think it really gave us all like a really good sense of hope, and how you know, seeing how another country is doing something well and kind of thinking about how that could be possible within your own country as well. So that was my experience in Austria. I really recommend people to do this program. I learned so much, even just personally, from going on the program and meeting even people in my own country who I wasn't connected with before. And just, you know, our WhatsApp group is still active from the group that was that I was with. We're still kind of chatting away every now and then and giving updates on our lives, and you know, it's a really great little network we have kind of created from our experience in Austria.
Thank you, Zoe, really for coming today. So we still have one more guest today. We have the coordinator from Finland, Lida. Please, Lida, give us a little impression from your side. Lida, can you connect, please?
Okay. No. Is Lida here? Otherwise, we will continue with the program.
Ida?
Hi, can you hear me?
Yes.
Now you
Thank
You can hear me now.
Yes, we can hear you.
Okay,
Thanks
great.
for
Sorry,
coming.
maybe there was some kind of audio problems.
Okay.
So, hello everyone. Before I start, I'm just checking. Great. Okay, Martina, you have my slides. That was the one I was checking. So great. So, thank you for having me here today, and thank you for this opportunity to tell some ideas and some thoughts and reflections of our Finnish. Shortly, I know we are a little bit running out of time, maybe, so I try to be very quick. So, my name is Ida Koivuniemi, and I work as a coordinator in Valopalmennus Association in Finland, and I had this privilege to be part of the EU-PROMENS Exchange as an organizer and as a designer of the program of our exchange. So, like Katarina already told us a little bit, but here you can see that our exchange was in the end of the March to 11th of April. And we had 77 or maybe 78, I'm sorry if I'm remembering it wrongly, but about anyway. So mental health professionals from across Europe. And they were here 2 weeks, and the group were divided into 2 groups. So one group was first week in Helsinki, and the other group was first week in Tampere, and then in the middle of the exchange, they changed the cities. And our program include an overview of public mental health care in Finland, but the main lead focused on services and innovative approaches of third sector providers. So our visiting places was in third sector organizations and providers. And in Finland, we did things a little bit different that ways that we have only one exchange this year. So we didn't have this three times and 3 groups exchange and participants because we took all the participants at the same time here in Finland. And of course, because of this large group size, we had to pay a little bit extra attention to the program, how we designed it, and for example, the logistic. But of course, the GFA's Rani made a wonderful job with all the accommodation and everything. So thank you once again. And yeah, you can go still back the last one. Thank you. So yeah, we divided the 2 main groups in the 4 subgroups, and these were quite successful, I think, because we had 4 animal groups: reindeers, goats, eagles, and owls, and they were very big source of humor and good team spirit. It was great to see how our participants actually connect with their own animal group. So yeah, now you can go to the next slide. Thank you. And here are some for my personal highlights from the exchange. In a bigger picture, I think the exchange was just very rewarding and amazing experience. And maybe the biggest highlight for me was the privilege to get to know all our participants, these amazing professionals in different fields of mental health.
And you could really see how the participants were highly motivated and interested in learning about mental health services in Finland and also sharing their own thoughts. They had so many questions for our sitting places, also very tricky questions, but I just think that showed that how passionate they are about their own work and promote the mental health. It was great to see that, and like I said to our participants, that for me personally, it always gives me hope to see that there are actually people who really wants to work in a field of mental health and promote mental health and also break the stigma of it. And yeah, it was valuable to hear and be reminded how good mental health services in Finland are, because I think that sometimes we take it for granted or maybe forget it or just complain about it. So it was a good reminder. And especially it was very important to hear what works better in other countries and what we can learn from them. Yes, next, please, Martina. Okay, and then last but not least, yes, I want to add here this, that I think it was great to see how our participants enjoyed the city of Helsinki and Tampere and the Finnish culture. Many participants told me that they were having this swimming in cold waters and trying Finnish sauna culture, and they were very excited about it. So it was great to hear that they had a lot of free time and they actually use it for in that kind of a way. So it was great to hear. And maybe in the end, I can just say that I hope that next year we can build and provide as inspiring and rewarding exchange, and also made it a little bit more, even more better, and a little bit more. We collect all the feedback and take a knowledge of it. So I'm just looking forward to get to know and learn more from these amazing professionals and see them and get to know their ideas and learn from them. So yeah, this was very short presentation from my side. So thank you very much for your attention, and it was great to be here today. So thank you.
Thank you very much, Zoe. Thank you very much, Lida. So we are coming now to the question and answers. I already started to answer different questions in the chat, but if you have comments or questions, there is not that much time anymore. So please come with your comments, questions, discussion, whatever. Yeah. Are there any questions? Really, no comments, no questions. Everything is clear.
I think we were too good.
You all will apply for the second wave?
I think the important question from Agnieszka, right? It's a really important question. I also answer now here. Yes, of course, we have a future vision how all this will lead. So we take in all the lessons learned from the exchanges. We have this monitoring process, also as Ida said, for the next wave, and then of course take in also the lessons learned to the toolkit. So at the end, we will have a document that we will share with every member state on the exchange and also on the trainings we roll out this year and next year. So all the three components go hand in hand of the EU-PROMENS.
also all the recommendations coming from, especially from the conclusive workshops, but also from the during the program, the discussions, the main outputs, all these new ideas and impressions will end up in which way ever in the toolkit. So we try hard to sample them all in this document and to keep them in the ongoing discussion, in the ongoing development process in Europe. Maybe one of the biggest challenges also, I see there are some general questions. There are some questions in the general chat.
Yes, there was a question also if one can take part in more than one exchange, and this is unfortunately not. I have to say no here, but because we really need to give everyone a chance for this experience.
But you can apply for the training. This is no problem. So when you participate in the exchange, the doors for the training are also open for you. So no problem to do it in this, but we cannot offer a second trip to a different locations because there are too many applications and for this.
Yeah, maybe I can just add something as I had now the chance to have a look at the chat. So I would like to clarify on the multiple applications. So when you apply for each country, you have, first of all, the chance to give your choice or your preference for the groups. So for those countries like Austria, for example, which have 3 groups, you can select which group you would like to attend. You can select more than one if you have no preference. So this is the first choice. And then about the possibility to apply for more than one hub. The better way is to do the application twice for each country. Of course, we are 3 EVA managers responsible for different countries. We cross-check every data, but just to be sure that you are in all the lists you want to be, you can apply to different countries. And I suggest that if you have a preference, I mean, if your first choice, for example, is Austria, but you are also interested in Spain, you can please feel free to mention this in the registration form or to send us an email. So there is some space to write in the motivation questions, and if you want, you can just note down. I also sign in for Spain, but my first choice would be Austria, for example. So maybe I forgot to mention we will show a slide just before closing with our contacts with my email. So you can, whatever doubts you have, question, necessity, you can just send us an email and it will be redirected to the responsible EVA manager of the country.
Okay. Just one comment from my side is a big challenge in this program, in the exchange program, is the different level of development in Europe. So when we have guests from, I don't know, Germany, Belgium, Finland, with a very, very high developed mental health service system compared with mental health systems in other countries in Europe. So we always have in the groups discussions around this and what we can do or what the European Union could do to reduce these differences in the level of development. So this is also one fact or one impact we hopefully have, that we can deliver arguments why it's necessary to do this and that, and we can also deliver for all these arguments most of the time evidence-based data and to show that this there is a research behind, and there are really good reasons behind why this development in this way is necessary and sensible. Okay, so Chiara, do you have a comment, please?
Thank you, Tom. I've listened carefully to all the testimonials and summaries from people that participated, and I'm very happy to see the wealth of positive experiences that were shared. And so I'm very happy. I'm happy also to see that we are disseminating more information on the future possibilities to register. So please spread the voice also in your own networks. And thank you so much for this opportunity. I'm available as usual for any further information or clarifications. And well, I hope to see you soon in one of the hubs or in these events online.
Okay, thank you very much, Chiara. So the last slide are our contact details, and please feel free to contact us, Martina, or other channels in the chat. Some of my colleagues also posted their email address, so please feel free to contact us also on Facebook or which channel ever, and we will answer your questions and yeah.
And
I really hope.
We recorded this session also,
Yes,
so it will be spread again also on YouTube if others are interested.
Okay, so if there are no comments, no questions anymore, it's 11:29, so we are absolute in time, and yeah, thank you very much for joining our webinar. I'm still very happy. Still a lot of people are here, and I'm so happy we had so many different countries, especially we had also guests from Paris and France. So thank you very much for joining us. Have a good day, have a good time, and see you somewhere in this mental health bubble all over Europe in one of our exchange or training or wherever. Thank you very much. Have a good day. Bye-bye.
Thank you all.
Thank you.
Bye. Bye.
Thank you. Goodbye.
Goodbye.